Welcome to Health Action, your guide to understanding swollen feet and ankles. Hello, and welcome back to Health Action, your trusted source for straightforward, natural, and practical health advice. We're here to empower you with simple solutions to feel your best every day. Today, we're diving deep into a common issue that affects so many people: swollen feet and ankles. Whether it's a mild annoyance or a recurring problem, puffiness in your lower legs can feel uncomfortable, heavy, and sometimes even concerning. But don't worry, we're breaking down 7 key reasons why your feet and ankles might be swelling and sharing actionable, natural steps you can take to find relief. By the end of this guide, you'll not only understand what's causing your swelling, but also know exactly what to do about it. From lifestyle tweaks to home remedies, we've got you covered with tips that are easy to incorporate into your daily routine. Plus, we'll let you know when it's time to check in with the doctor. Let's get started and help your feet feel light and comfortable again. 1. Poor circulation. When blood flow slows down. One of the most common reasons for swollen feet is poor circulation. If you spend long hours sitting at a desk, standing in one spot, or traveling, like on a plane or in a car, gravity can cause blood and fluid to pool in your lower legs. This leads to that heavy, swollen feeling in your feet and ankles. Why it happens? When you're not moving much, your calf muscles aren't helping pump blood back up to your heart. This causes fluid to settle in your feet, making them puff up. What you can do: take movement breaks. Every hour, stand up and walk around for 2 to 3 minutes. Even pacing around your living room or office helps. Try ankle exercises. Sit down, lift one foot, and rotate your ankle in circles, both directions, for 1 to 2 minutes per foot. This gets your blood flowing. Elevate your legs. Lie down and prop your feet up on pillows so they're above your heart for 15 to 20 minutes, ideally once or twice a day. This helps fluid drain naturally. Wear loose clothing. Tight pants or socks can restrict blood flow, so opt for comfortable, breathable clothing. Incorporating these habits into your day can significantly improve circulation and reduce swelling. Think of it as giving your legs a little wake-up call. 2. Too much salt, the hidden culprit. If your diet is high in sodium, your body might be holding onto extra water, which can lead to swelling in your feet and ankles. Salty foods like chips, fast food, processed snacks, and even some canned goods can cause bloating and puffiness. Why it happens? Sodium makes your body retain water to balance things out, and that extra fluid often collects in your lower extremities, like your feet and ankles. What you can do? Cut back on processed foods. Swap out salty snacks for fresh options like sliced cucumbers, carrots, or apples. Read food labels. Look for low-sodium versions of canned soups, sauces, or snacks. Aim for foods with less than 140 milligrams of sodium per serving. Flavor naturally. Use herbs like rosemary, thyme, or cilantro, or add a splash of lemon juice or vinegar to your meals instead of reaching for the salt shaker. Balance with potassium-rich foods. Foods like bananas, avocados, and sweet potatoes help counteract sodium's effects and support fluid balance. Reducing salt doesn't mean giving up flavor. Experiment with new spices and ingredients to keep your meals exciting while keeping swelling in check. 3. Injury or trauma. Your body's healing response. If you've recently twisted your ankle, banged your foot, or experienced any kind of injury, swelling is a natural part of your body's healing process. Sprains, strains, or even minor fractures can cause localized puffiness as your body sends fluid and blood to the area to repair it. Why it happens? When you injure your foot or ankle, your body increases blood flow to the area, which can lead to fluid buildup and swelling. What you can do? Rest the injured area. Avoid putting weight on the foot to prevent further strain. Use crutches or a cane if needed. Apply a cold pack. Wrap an ice pack or a bag of frozen peas in a cloth and apply it to the swollen area for 10 to 15 minutes every few hours. This reduces inflammation. Elevate the foot. Keep your foot propped up on pillows to minimize fluid buildup. Use a compression wrap. A light bandage or wrap can help control swelling, but don't wrap it too tightly. If the swelling lasts more than a few days, the pain worsens, or you can't bear weight on the foot, see a doctor to check for something more serious, like a fracture. 4. Medical conditions. A sign to pay attention. Certain health conditions can cause or contribute to swollen feet and ankles. For example, diabetes can affect circulation and lead to fluid retention. Heart conditions, kidney problems, or liver issues can also cause your body to hold onto fluid, resulting in puffiness. If you have a chronic condition, swelling might be a sign that it needs better management. Why it happens? Conditions like diabetes can damage blood vessels, slowing circulation. Heart or kidney issues can disrupt your body's ability to regulate fluid, leading to edema. What you can do? Work with your doctor. Follow a treatment plan tailored to your condition, which might include medication, diet changes, or lifestyle adjustments. Monitor symptoms. Keep track of when swelling happens, how severe it is, and if it's paired with other symptoms like fatigue or shortness of breath. Follow a low-sodium diet. This can help manage fluid retention, especially for heart or kidney conditions. Stay active within your limits. Gentle movement, like walking or stretching, can improve circulation without overdoing it. If you suspect a medical condition is causing your swelling, or if it's sudden and severe, reach out to a healthcare provider for a proper diagnosis and guidance. 5. Medication. Side effects. An unexpected cause. Some medications can cause swelling as a side effect, especially in the feet and ankles. Common culprits include blood pressure medications, like calcium channel blockers, steroids, antidepressants, or nonsteroidal anti-inflammatory drugs, NSAIDs. Why it happens? Certain medications can affect how your body handles fluid or blood flow, leading to edema in your lower legs. What you can do? Talk to your doctor. If you've noticed swelling since starting a new medication, let your healthcare provider know. Don't stop taking any medication without their guidance. Ask about alternatives. Your doctor might be able to switch you to a different medication with fewer side effects. Combine with lifestyle changes. Elevating your legs, reducing salt, and staying active can help manage swelling while you're on the medication. Your doctor can help you balance the benefits of your medication with any side effects, so don't hesitate to have an open conversation. 6. Hormonal changes. A temporary shift. Hormonal fluctuations can lead to fluid retention, causing swelling in your feet and ankles. This is especially common during pregnancy, menstruation, or menopause. Pregnant women, for example, often experience swollen feet due to increased blood volume and pressure from the growing uterus. Why it happens? Hormones like estrogen and progesterone can affect how your body regulates fluid, leading to temporary puffiness. What you can do? Stay hydrated. Drink 8 to 10 cups of water daily to help your body balance fluids. Wear supportive shoes. Choose comfortable, low-heeled shoes to reduce pressure on your feet. Try gentle exercise. Activities like prenatal yoga for pregnancy or light stretching can improve circulation and reduce swelling. Rest and elevate. Take breaks to put your feet up, especially during pregnancy or hormonal shifts. If you're pregnant or experiencing significant hormonal changes, consult your doctor for personalized advice to keep you comfortable. 7. Inactivity. When sitting still takes a toll. A sedentary lifestyle can slow down your body's circulation, causing fluid to pool in your feet and ankles. Whether it's from a desk job, long travel, or too much time on the couch, lack of movement makes it harder for your body to pump blood and fluids effectively. Why it happens? Your calf muscles act like a pump to move blood back to your heart. When you're inactive, this pump doesn't work as well, leading to fluid buildup. What you can do? Add mini movement breaks. Try a 5-minute walk, stretch, or even toe tapping every hour. Do calf raises. Stand up, lift onto your toes, and lower back down for 10 to 15 reps to boost circulation. Use a footrest. If you're sitting for long periods, elevate your feet slightly to encourage blood flow. Try compression socks. These provide gentle pressure to support your veins and prevent fluid buildup. Even small bursts of movement can keep your circulation humming and reduce swelling over time. When to seek medical advice. While these tips can help with mild or occasional swelling, sometimes it's a sign of something more serious. Contact a healthcare provider if swelling comes on suddenly or is extremely severe. You notice pain, redness, or warmth in the swollen area, which could indicate a blood clot. Swelling is paired with symptoms like chest pain, shortness of breath, or dizziness. The swelling doesn't improve after trying home remedies for a few days. Your health is the priority, so don't hesitate to get professional advice if something feels off or persists. Putting it all together. Swollen feet and ankles don't have to hold you back. By understanding the 7 common causes, poor circulation, too much salt, injury, medical conditions, medication side effects, hormonal changes, and inactivity, you're empowered to take the right steps to feel better, whether it's moving more, tweaking your diet, elevating your legs, or checking in with your doctor. These natural strategies can help reduce puffiness and keep your feet feeling light and comfortable. At Health Action, we're passionate about helping you live your healthiest life with simple, effective solutions. If you found this guide helpful, give it a big thumbs up, share it with someone who might need it, and follow Health Action for more practical health tips. Do you have a favorite way to deal with swollen feet? Share it in the comments. We'd love to hear from you. Until next time, stay healthy, keep moving, and take care of those amazing